My name is Dr. Haisam AbdulKader. I work as assistant professor in Department of Nephrology in Yenapoya Medical College Hospital, and I also sit in a clinic in Mangalore, Falnir Road, Euro Health Plus. I thank Dr. Reddy's for giving me an opportunity to speak on to know about kidneys. So I would like to divide my topic into few sections in a few minutes, then and the next 15 minutes of talk. First, I would like to give an introduction on the kidney. After that, uh, what are the functions of kidney, and how can we divide the kidney diseases into acute kidney injury and chronic kidney disease? What are the clinical features? How to investigate and how to treat? So coming directly into the introduction of the kidney. Everybody has got a pair of kidneys which is located in the retroperitoneally, and each kidney measures weighs around 125 to 160 grams, and 125 to 160 grams in an adult male or adult female. That is 70 kilograms, adult male or adult female. The weight of a kidney is only 150 grams approximately, and that constitutes only 1% of the total body mass. However, it receives 20% of the cardiac output. That means the blood which is pumped by the heart, of which 20% is 1/5 of the blood flow is going to the kidneys, which only constitute 1% of the body mass. And now I would directly go into the functions of the kidney. So why does kidney receives 1/5 of the blood flow in a resting conditions? Because it performs a numerous amount of functions, of which the most important is removal of the waste products, excess waste, which includes urea, creatinine, and there are thousands of other waste, of which easily measurable waste is blood urea and serum creatinine. There are also numerous waste which is difficult to be measured in the blood. That is also being excreted by the kidneys. Another important function is to maintain a proper balance, that is acid base balance. Acids is secreted by the cells and the tissues in the body. There is a balance for acid and the base, and the excretion of acids is done by the kidneys. So what happens in the final stage of kidney disease? The acid will increase and it leads to a condition called metabolic acidosis. Another important function is it also plays a it will regulate the level of calcium, phosphorus, vitamin D, and parathyroid hormone level in the blood. It maintains a normal level of calcium. It also produces a hormone called erythropoietin, and this hormone, erythropoietin, that will help in normalizing the hemoglobin. So, final stage of kidney disease, this hormone is not produced, hence that leads to low hemoglobin or anemia. Then, apart from that, it also produces an active form of vitamin D. Vitamin D is very important in multiple systems in the body, because deficiency or low level of vitamin D can cause numerous number of diseases. Nowadays, we know that low vitamin D is linked with many diseases, including diabetes, hypertension, arthritis, etc., obesity, hypothyroidism, etc. Now, how can we categorize the kidney disease? Kidney disease, it can be categorized broadly into two, that is acute kidney injury and chronic kidney disease. Acute kidney injury means the kidney disease which has occurred, which was of a sudden onset, and which is reversible once the causative agent is treated. While chronic kidney disease, according to the terminology itself, it's a chronic disease, and the disease has progressed over time, and the kidney function, the GFR is less than 60 ml per minute. The normal GFR in a person is, in a male or a female, in an adult person, is 120 to 120 ml per minute, while in the case of to define CKD, the GFR will drop below 60, which has lasted for 3 or more months. Now, so the best thing about acute kidney injury is that it is reversible. It can come back to the normal state, and the creatinine will come back to the normal. Now, how to classify the CKD? CKD means the normal GFR, as I told, is 120. So, above 90 ml per minute with the presence of any structural or functional kidney disease is stage 1. 60 to 90 ml per minute is stage 2. Less than 30 to 60, that is stage 3, which itself can be divided into stage 3A and stage 3B. And 16 to 30 GFR is stage 4, and when the GFR is less than 15 is chronic kidney disease stage 5, or easy terminology is ESRD, end stage renal disease. Now, what are the causes of kidney disease? Kidney disease can be due to any number of there are numerous number of causes, which can be even the simplest of causes, such as dehydration. When a person is dehydrated, we know that the amount of urine which is passing is very uh, higher in color, that is orangish or yellowish in color. That is, he passes a concentrated urine, because the kidneys has got a very good capacity to concentrate the urine. It will absorb the water, and it will excrete only the waste products, and that's why we see a very high colored urine. So dehydration itself can cause a slight rise in the creatinine. And other causes such as infections can be even malaria, it can be leptospirosis or rat fever. There are even enteric fever or typhoid fever, and the other causes such as intake of painkillers for a large number of so many days, more number of tablets. Some people who has a habit of taking painkillers continue to take those tablets, they have a higher risk of kidney disease. Then, so these are then another important cause is obstruction, which can be in the form of stones. Um, the commonest cause of obstruction is stones. Uh, the stone obstruction can occur either within the kidney, or it can occur below the kidney, that is in the ureter, in the junction between the ureter and the urinary bladder, or even below the bladder. So obstruction can also cause into a rise in creatinine. Now, how can we investigate for a kidney disease? All investigations in nephrology, they are not very expensive. It is easily available. The simplest and the easiest of test is serum creatinine. The normal serum creatinine in any person is between 0.7 to 1.3 milligram per deciliter. Once the creatinine rises above this level, that is above 1.3, then we have to be the person has to be a little cautious. He has to consult a nephrologist, and he has to be evaluated what has caused the rise in creatinine. The commonest cause for chronic kidney disease is diabetes mellitus. It is that is the most prevalent cause of chronic kidney disease, diabetes mellitus, whether it is type 1 or type 2 diabetes mellitus all over the world, not only in India. Hence, a very good control of blood sugar is very, very important to prevent the progression of kidney disease, and the evaluation and a regular follow-up is very, very important. Because around 50% of the cause of chronic kidney disease is due to long-standing diabetes, and diabetes mellitus is not a single disease; it is a systemic disease. It can affect all the systems. The long-standing diabetes in the kidney, it will affect in the form of diabetic nephropathy or diabetic kidney disease, which is easily manifested by loss of protein in the urine. Normal amount of protein which is to be excreted in urine in a day is less than 150 milligrams, or less than 30 milligram of albumin. What happens in chronic kidney disease due to diabetes? The amount of albumin excreted is more, that is more than 30 milligram per day. So once it is above 30, between 30 to 299 milligram, it is called microalbuminuria. Microalbuminuria is an old term. The present term is moderately severe, moderately increased proteinuria. And once the albuminuria or albumin which is excreted more than 300 milligrams per day, that is severely increased proteinuria. So what happens in diabetes initially, as I told, the GFR is 120 ml per minute in a normal person. Initially in diabetes, there is a hyperfiltration. So the GFR increases. The GFR it goes above 120. After few years, it will come back to normal. That is normal GFR of 120. Then it comes down again, and it drops. The GFR will drop. GFR is the glomerular filtration rate. It is nothing but the ultrafiltration of the blood. So serum creatinine is the simplest of tests which can be done, easily available. The next test is urine analysis and urine albumin creatinine ratio. Urine analysis has to be done just to look whether there is any pus cells in the urine. Presence of pus cells means it shows that there is evidence of infection, likely. Suppose the presence of any fever, chills, rigor, any pain in the loin, along with the presence of numerous or increased pus cells in the urine, that is suggestive of urinary tract infection, which is also one cause of increase in creatinine or acute kidney injury. So the pus cells has to be looked for. Second is protein, as I already told. The normal in a normal urine analysis, protein is negative, and if we quantify the urine, the protein excreted in a day is less than 150 milligrams. Then next to look is RBC. RBC is whether it is there in urine or not. Then ultrasound abdomen and pelvis also is it's a simple scanning of an abdomen. It is a non-invasive test. That means there are no radiations. That test easily helps to rule out any obstruction. Obstruction is also, as I earlier told, it's one cause of kidney disease. Obstruction can be either in the form of stones, in the form of tumor in females, carcinoma or cancer of the cervix. Cervical cancer can cause obstruction, and both ureters, which are coming from the kidneys, can be obstructed, and it can lead to a rise in creatinine. And if this obstruction is not relieved immediately, this becomes chronic, and it leads to CKD. CKD, the problem is it is irreversible damage to the kidney, and as the kidney disease progresses and reaches to the final stage, or GFR is less than 15 ml per minute, the person is left with only two options. That is either dialysis or transplant. Dialysis or transplant, depending on the person. If it's a young person, definitely below the age of 50 or even below the age of 55, renal transplantation is a much better option compared with the hemodialysis. If he is fit for that, that is to be decided by the nephrologist. So diabetes mellitus is the commonest cause. Other causes of kidney disease is hypertension. Then systemic hypertension itself can worsen the kidney disease, as well as kidney disease itself can increase the blood pressure or BP. That also will increase the creatinine. It is just like a cycle. The other causes is chronic obstruction, then chronic glomerulonephritis. That means excretion of protein in the urine without diabetes. Chronic glomerulonephritis can occur even without diabetes. That is increased excretion of protein in the urine. The blood pressure goes up. So how can we investigate this? Just take a urine analysis, and still if the diagnosis is not clear, then kidney biopsy will have to be done. Kidney biopsy is the gold standard. It will help us in knowing the diagnosis. It is not a treatment. It will just help in knowing what has caused the kidney disease, and it is based on uh, this investigation, that is the kidney biopsy, which is done, which takes only 2 minutes, but the patient will require admission for 2 to 3 days in the hospital for that procedure. Then intake of painkillers for a long time. that has to be stopped. Now, what is the treatment of this? The treatment is to treat the cause. So, if diabetes has led to the kidney disease, very good control of blood sugar, optimal control of the blood sugar, optimal control of the blood pressure, periodic follow up, periodic monitoring, and a regular follow up. And every year, eye has to be checked because diabetes mellitus itself can cause retinopathy, diabetic retinopathy. So, annual examination, once in a year, annual fundus examination is really important to look whether there is damage that has occurred to the eyes. And depending on the findings, the treatment has to be decided whether laser treatment is required or not. Uh, then HbA1c is one test where we will know the blood sugar control in the last 2 to 3 months. It has to be below 7. Ideal level of HbA1c should be below 7. The normal HbA1c in a person is less than 5.7. Between 5.7 to 6.4 is a pre-diabetic range, and above 6.5 is diabetes mellitus. The fasting blood sugar has to be less than 100 milligram per deciliter. The postprandial or blood sugar after 2 hours of food intake should be less than 140. This is a normal value, 140 milligram per deciliter. So the treatment is always to treat the cause. If obstruction was the cause of the kidney disease, immediate relieving the obstruction is important before it progresses to reach a chronic kidney disease. Um, yeah. Now, how to prevent kidney disease is we have to we have to know proper awareness about the disease, and when there is any swelling in the legs, immediately urine analysis has to be checked whether is there any protein, excessive protein being excreted in the urine. The blood pressure has to be periodically checked. Blood sugar has to be periodically checked. Ultrasound, any pain in the abdomen, it could be due to a stone, renal calculi. When there is pain, it can also be due to appendicitis. It can be due to cholecystitis, that is gallbladder infection. All can be diagnosed by a simple scan called ultrasound scan, and all are treatable. Yeah. So screening for kidney disease is not a very difficult task. Sending serum creatinine, ultrasound abdomen, pelvis, urine analysis, and further investigations can be done based on the clinical judgment. Like there are conditions where the kidney disease progression is very fast. That is called RPRF, rapidly progressive renal failure, or RPGN, rapidly progressive glomerulonephritis, which can in which the creatinine suddenly jumps from 1 to 2, and within few weeks it can rise to a very high level, and which is an emergency in nephrology. So proper awareness of the condition, periodic checkup, and uh, and knowing the serum creatinine is really important. Is there any doubts? Am I audible?
Yes, sir, you are audible. Yes, doctor. Doctor, is the session finished?
Yeah, I think I will stop here, and if there are any doubts to clarify, I would clarify.
Okay. Can you see the comments here?
Yeah, 1 second. Yeah, okay. Yeah, okay. I'll speak more on renal transplant now. Renal transplant. I hope I'm audible.
Yes, you are.
Yeah, yeah. So as I told, when the GFR goes below 15 ml per minute, there are two options left. There is dialysis or transplant. Dialysis itself, there are two forms. One is hemodialysis or peritoneal dialysis. Hemodialysis to be done at in the hospital or in the center, while peritoneal dialysis is a dialysis which can be done at home. And the second option is renal transplantation. In what happens in renal transplantation is uh, the kidney from the uh, donor is transplanted into the recipient's body, even without removing the native kidneys of the recipient. So the recipient will have three kidneys, and the residual that is a normal present kidneys in the recipient is not removed, and that is not going to do any harm. So the benefit of that is it will help in maintenance of the normal calcium, phosphorus, which I have told, which is not done by dialysis. A patient who is on dialysis will have to be on all medications such as antihypertensives to maintain the proper calcium, phosphorus, parathyroid hormone. Those medications has to be continued by the patient on dialysis. But once the transplantation is done, the fun other than removal of the functions which is other than removal of the waste products and maintenance of acid base balance is also done by the graft kidney or the kidney which is transplanted by from the donor. And the best thing is that even after donating, the donor does not have any problems. The creatinine continues to be normal, and the donor can continue her life without any medications after donation. However, the recipient will have to be continued on immunosuppressants. What are those immunosuppressants? Are those medications to prevent rejection, because a foreign body is being transplanted into the recipient. So there is a risk that the body can reject that organ. To prevent that, the patient, the recipient, or the person who has received the kidney has to be continued on medications, which has to be regularly taken with a regular follow-up with a renal transplant physician, and to adjust the dose uh, according to the creatine and other levels. Yes, I will just check the comment box. Okay, I yeah. I saw in the comment there is a person with HCV positive, that is hepatitis C virus positive, whether they can receive the kidney. Yes, definitely hepatitis C virus patient, uh, they can be treated. It is fully treatable condition with the 12 weeks of anti-hepatitis C virus medication called DAA that can be taken, and the hepatitis C virus is treatable, and after that he can be transplanted. The next question is, what is the normal blood urea level? The normal blood urea level is between 15 to 35 milligram per deciliter. The normal serum creatinine is between zero point 0.7 to 1.3 milligram per deciliter. So, what are the other investigations which can be done? Those are serum calcium, serum phosphorus, serum uric acid. Uric acid has to be treated, and the when the blood uric acid level increases to a level, it can lead to a condition called gout. Gout means there is it can cause gouty arthritis, that is pain in the joints. Commonly, the pain is there in the first metatarsophalangeal joint, that is the great toe, the great toe, or even in the ankle joint. Initially, it can be present only in a single foot, and later it can be present in the other foot as well. So, serum uric acid Am I audible now?
Yes, doctor.
Yes. Uh, Now I will talk on dialysis. Dialysis means hemodialysis ideally has to be done thrice in a week. That is, and each session of dialysis lasts for 4 hours. If the dialysis is terminated below 4 hours, it is a suboptimal dialysis. And dialysis is nothing but a process by which the blood is taken from the body, and it is entering into the machine where, and there is a filter called dialyzer filter, and it is filtered, and the pure blood is being returned back to the body. So there are two processes which are occurring. One is removal of excess fluid. Second is the removal of excess waste. This is called a diffusion and ultrafiltration. So these two processes are being carried out during every session of dialysis. So ideally, dialysis has to be done thrice in a week, with each session of dialysis lasting for 4 hours. when when a patient has to be on dialysis, that is to be decided, and the decision has to be taken by the treating nephrologist, because there are two forms of dialysis. One is the dialysis that has to be continued, which we call the maintenance hemodialysis, or that means the dialysis has to be continued lifelong, weekly thrice in a person has to be continued lifelong. One is another form of dialysis called dialysis, which has to be done till the kidney improves, and once the kidneys has started improving, dialysis can be terminated. This is commonly seen after an episode of infection, such as uh, leptospirosis or rat fever. Rat fever, it can affect mainly two organs. One is the liver, and second one is the kidney. Liver, it can cause jaundice. The bilirubin can go up, and it can cause acute or a sudden onset of liver failure. In the kidney, it can cause acute kidney injury, and the creatinine can go up to such an extent that the person will require dialysis, and dialysis will have to be continued until the person improves. And the creatinine has to be terminated, and the decision has to be taken by the nephrologist and the treating transplant physician whether it time for removing the dialysis, stopping the dialysis. How a dialysis is done? First, initially a dialysis catheter has to be inserted into the neck or into the leg. In the neck, once it is inserted, is called internal jugular venous HD catheter, and in HD catheter or hemodialysis catheter inserted in the leg is femoral HD catheter or femoral venous HD catheter. Are there any doubts? There are not much doubts again. Yeah. Creatine 7. In the comment box, I can see a person with creatinine of 7. Creatinine of 7 is a very high value. It has to be immediately shown to a nephrologist, and he has to be evaluated. Why the creatinine has gone up to 7?
If there are no comments, we can end, doctor.
Okay.
If it is okay with you.
Okay.
Thank you, doctor.
Yeah. Welcome.